Hi everyone, welcome back to our health and wellness blog. Thank you again for stopping by. So this week I'm just going to spend a few moments talking about something that's been in the news lately. I think it actually came out officially last week about the connection between COVID-19 and a rare but serious health condition in children called multisystem inflammatory syndrome. And while it's a very rare finding, it's something to be aware of as we continue to learn more about how COVID-19 affects children in particular. Most children diagnosed with COVID-19 have mild clinical presentations and are able to recover from it pretty well. But the severity of multisystem inflammatory syndrome can be concerning. And with those cases, most of those cases, they've had to be hospitalized in intensive care units to manage and stabilize their symptoms. So it's definitely something to be aware of. And experts are still learning about the syndrome and its connection with COVID-19. But one thing that they found is that there are a broad range of symptoms, including diarrhea, vomiting, severe abdominal pain, and then in half of those patients, respiratory symptoms, they didn't experience respiratory symptoms. So it seemed to run the gamut as far as symptoms that they saw, and it wasn't always the classic coughing or shortness of breath. So just something to be aware of. One of the biggest concerns in general is that there may be some hesitation for parents to take their children into the doctor to see the pediatrician or to the ER or urgent care, with the fear being that they may be exposed to the virus by just simply taking them into the facility. But doctors really want to stress that please do not ignore symptoms and to reach out to your pediatrician if you notice a persistent fever or any of the other symptoms of COVID-19, in addition to symptoms that may be different from the classic symptoms that we've heard, because we're still learning more about the virus. So don't ignore any symptoms, and be sure to reach out to your pediatrician for further guidance, even if it's through a telemedicine visit. That way you want to make sure that your child doesn't need to be seen or to be tested or further treatment or management of their symptoms, no matter how mild they seem to be. And then the best thing to do and to continue to do is to just do your part in protecting your family and your household from COVID-19 in general. So continue with the good hand washing, with social distancing, and wearing your mask out in public. Although things are starting to reopen, certainly we still need to continue to take those precautions so that we decrease our risk of contracting COVID-19 in the first place. So just something to be aware of, not to scare you, not to make you anxious or nervous, because it is a rare condition that they're finding a connection between COVID-19 and this multisystem inflammatory syndrome, but something just to be aware of, and just to know that there are multiple symptoms that can present, and that we just need to be aware and be in close contact with our healthcare provider should we notice those symptoms in our children especially. So take care, stay well, and have a great week.